this virus can change and can change fairly rapidly.
That blunt assessment by Dr. Andrew Beck is informed by data, not public perceptions. I spoke to Beck and 2 other doctors who analyzed real-time regional coronavirus case counts in partnership with numerous medical teams and the Center for Clinical and Transitional Science and Training at UC and Children's Hospital.
There's an enormous amount of information sharing now taking place across hospitals.
Some of that information includes hospitalizations of COVID patients. This graph shows plot points of raw numbers. Tonight, that's more than 175. You can see an upward trend since mid-June and higher numbers today than at any point in the pandemic. ICU beds not at the peak after a big decline last month, but still headed in the wrong direction. The total tonight stands at 55 COVID patients out of 435 current ICU patients in our area, according to the Ohio Department of Health.
Instead of continuing to go down, we start to see ourselves going up.
A different look now at the number of critical care beds available. This covers everything from COVID cases to heart attack victims, for example. We're in the yellow at 84% of capacity. The danger zone starts at 95%, but even then we would have room to expand to as much as 161% of capacity.
We do have space that we can give, but we need to be very attentive as we're starting to get up into the zone of full hospital beds.
One point of public contention is the coronavirus death rate. Here's the data from hospitals in Greater Cincinnati. You can see we've been trending downward since mid-May, but the doctors tell me tonight we need to pay close attention to that last blue dot marking more than 20 deaths. What happens when we add more dots next week will be critical.
Come next week when we put the next dot up and it's higher than the last one, then that means that that surge of cases that we just saw has funneled through the system and had a series of bad outcomes.
Now, another important piece of data is what's known as the R factor. It represents how many people someone with COVID-19 is likely to infect. The experts tell me an R factor above 1 is not good. Our region's R factor tonight coming up at 6. For now, reporting live, Todd Dykes, WLWT News 5.
Todd, this can all make your head spin. It's a lot to keep track of. What did the doctors say about testing?
Yeah, there really is so much data, Ashley. You know, one of the most pressing concerns when it does come to testing here locally is the growing lag time that someone gets a test and it takes a while to get the results back. Ideally, a person would know if they have the virus in 1 to 2 days max, but because there's been so much testing, we've all seen it in our area of late, that labs can be overwhelmed, stretching that turnaround time to around 3 days. Ashley?